So Keynote-177 was presented by the group in France. It was a study that sort of a real world study. They took patients who were MSI high and they randomized patients to essentially dealer's choice chemotherapy. So you could use FOLFOX, FOLFIRI with or without bev or cetuximab, any of those, versus pembrolizumab, single dose pembrolizumab. And it was a straightforward randomization, and really a pretty remarkable result in that 2/3 of the patients did spectacularly well, and in fact the PFS has not been reached in those patients. You're talking, 3 years, 4 years versus a year for PFS for the patients just getting chemotherapy. On the other hand, 1/3 of the patients got no benefit whatsoever to the pembrolizumab, and in fact the curves favored the chemotherapy over the first year or 10 months, and then they crossed. It's very unusual, but it tells you that there's a subset of patients who just plain get nothing out of the pembrolizumab. And it remains to be seen if at the end of the day, overall survival will be different, because in fact, the patients who progressed were offered the option of crossing over to pembrolizumab, which they did. So it's not out of the question that the survival may all come out the same, the checkpoint inhibitor before or later. Although the toxicity is so much less, the PFS is so dramatically better, it's hard not to think of starting with the checkpoint inhibitor because patients can get such durable responses. However, you have to be vigilant because some patients get no benefit at all. And this is crucial. And in fact, if you look at another data set that's out there, which could have results very similar, there's a data set on nivolumab and ipilimumab, which was actually has been presented by Mike Overman, who gave, I thought, a great discussion today about the Keynote study. And what they showed is similarly, patients could do spectacularly well, maybe 70%, and then the other third don't get any benefit. And it's critical to know that you have to figure out those patients right off the bat, because if you wait too long, you may not get any treatment into them, and they may live much shorter than they would have had you used chemotherapy. He referenced our study, 80405, at least as one of the few data sets that can give any information as to the results they had in the Keynote. And our data set, many smaller patients, but we showed that the median survival with chemo-bev was 30 months in MSI high patients, but with let's say, EGFR antibodies was only 10 or 11 months. So in fact, I think the biology is incredibly different, and there's some factors within this population that we need to figure out. As with all these biomarker-driven studies, it's never black or white, and so there's a lesson here. It's an important advance, but it's not a slam dunk because, as always, there's a little more to the story than we want there to be.